welcome to the Idea Exchange podcast. In today's episode, we are talking more about hernias. I'm your host, Wes Pili, and our guest is
Vincent Chilemba.
welcome.
Thank you.
What is hernias?
A hernia is when a tissue or an organ pushes through a weak spot in its surrounding muscle or surrounding tissues. So this happens in different circumstances when a tissue or an organ pushes through a weak spot. But most of the times when someone mentions about a hernia, they're probably referring to abdominal hernias. So this happens when an abdominal organ, most of the times the intestines, they push through the abdominal wall, pushing through the abdominal wall to the outside. And as I've said, can also happen in other organs as well. It can also happen in the brain when part of the brain tissue pushes through the divisions of the brain. But for this talk, we'll be focusing on abdominal hernias. So every time I say hernia or the host says hernia, they'll be definitely referring to abdominal hernias.
What are the different types of hernias?
So hernias can be classified into different groups, and they can be grouped based on location, like a specific place, specific section of the abdominal wall they push through. So they can be inguinal hernias. So these hernias is when the intestine push through the inguinal canal to the outside. The femoral hernias. So this happens when the intestine pushes through the what femoral canal. So this is on the medial of the thigh, like the inner thigh to the outside. It can also be umbilical hernias. So this is when the intestines pushes through the umbilicus or the belly button. They can be classified based on causes. So in this group, you mostly have congenital and acquired. So congenital hernias are due to defects in the formation of the abdominal wall. So they might present in early childhood or in babies. Acquired hernias will happen later in life due to other conditions. They can also be classified according to clinical cause. So they can be classified in a spectrum from asymptomatic to strangulated. So asymptomatic hernias are hernias that do not show any symptom. So they can be a bulge on the abdomen because the intestines are pushing through the abdominal wall, but they are not associated with any symptom. There is no pain, there isn't any constipation or any other symptom. They can now later on turn into asymptomatic. So this is when the hernia starts to be painful or when the hernia starts to be associated with other conditions or other presentations like pain, nausea, and constipation. Then it can proceed to become irreducible. So this is when a hernia or the bulge on the abdomen cannot be pushed back, when the intestines cannot be pushed back into the abdominal cavity. And the end stage would be strangulation. So this happens when an irreducible hernia gets cut off. Breast supply through the irreducible hernia gets cut off. So this happens when the organs that have the intestinal organs that have protruded the abdominal wall, they don't have any breast supply coming to them.
How common are hernias and which population are most affected?
So currently there isn't any data on the incidence and prevalence of hernias in Malawi, but it has been shown to be more common in males, and on most of the studies done, it was shown that it is common in specifically in males who are involved in farm work.
What are the primary causes of hernias?
So basically, a hernia is when an internal organ, this in this case, intestine is pushed through the wall, as I've said earlier. So the primary causes of hernias are weakness of the abdominal wall. So when the abdominal wall is weak and has given way to the organs to come out, or when there is increased pressure in the abdomen. So when there is so much pressure in the abdomen, this can be associated with ascites, buildup of fluid, can be associated with constipation when there is buildup of feces. It can also be associated with pregnancy when there is a baby growing in the womb and has pushed the abdominal organs. Or can also happen during weightlifting. So there can also be increased abdominal pressure during weightlifting. This can lead to a hernia. Or when there is a surgical incision. So this is a cut that has been made on the abdomen to access the abdominal cavity during surgery. So when there is a surgical incision, uh, it introduces a weak spot from which internal organs can push through.
How do hernias impact the quality of life and overall health?
So hernias directly impact the quality of life and overall health, uh, mainly because they're painful, especially when they're irreducible. They can inflict a lot of pain on the individual having them. So this can definitely reduce the quality of life and overall health. It can reduce activity because some activities that typically increase abdominal pressure must be avoided in individuals who are predisposed to developing hernias. And they can also get complicated. So when they are complicated, so this is when they are strangulated and they can cause bowel obstruction, they can cause bowel ischemia, and they can cause serious inflammatory conditions, and this can affect uh, physical health greatly.
How do lifestyle factors contribute to hernia development?
So lifestyle factors can contribute to hernia development. So these would be lifestyle factors that can contribute to weakness of the abdominal wall or increased pressure in the abdominal cavity. So like heavy weightlifting. So heavy weightlifting can increase abdominal pressure. So this is a problem when someone who does not have uh, a well trained or doesn't have a strong abdominal, maybe someone who does not focus on their core when working out is attempting to carry a heavy weight. So during the strenuous activity, during the heavy weightlifting, the the pressure in the abdomen can build up so much that it can cause a hernia. Other lifestyle factors, obesity. So when someone is obese, especially those who have central obesity, they may have buildup of fat in the abdomen. So the buildup of fat will increase pressure in the abdomen and can lead to a hernia. Also, pregnancy. When a baby is growing in the womb, it can push the abdominal organs and cause increased pressure in the abdomen. And this increased pressure in the abdomen can lead to a hernia. Other lifestyle factors can be nutrition. So when someone is malnourished, they might have a weak abdomen or a weak abdominal wall, and they might be predisposed to herniation. Another factor can be inactivity. When someone is inactive, they might have a weak abdomen and they can be exposed to hernias.
What role do medical conditions play in the hernia risk?
Or some medical conditions can be implicated in hernias or can directly contribute to formation of hernias. and some of them are diabetes. So when someone has diabetes, they have reduced wound healing capabilities. So when someone who has diabetes has had a surgery on the abdominal wall, or they have had an incision on the abdominal wall, the wound may not heal as fast, and this might predispose them to herniation. So these are specific herniations that can protrude through the incision that was made. And also the COPD, chronic obstructive pulmonary disease. So this condition involves uh, chronic coughing. So someone who has COPD tends to cough a lot because they have build-up of pus in the pulmonary system, in the airway and the lungs. So whenever someone coughs, they push down the lungs and increase pressure in the abdomen. And this chronic coughing can cause so frequent increase in pressure of the abdomen that can cause the abdominal organs to push through the abdominal wall. Another medical condition is chronic constipation. So when someone is constipating, there's buildup of feces in the intestines, and this buildup of feces can cause increased abdominal pressure and predispose them to develop a hernias. And another condition is ascites. So ascites is buildup of fluids in the abdominal cavity. So when someone is ascitic, it does increase abdominal pressure and can predispose them to hernias.
How do environment factors impact hernia risk?
So some environmental factors can directly increase the risk of developing a hernia. For example, increased pressure. So this increased pressure can be due to heavy lifting, as I've explained earlier. Can also be poor posture. This can be poor posture during heavy lifting or just poor posture in general. So these would be postures that will directly increase the abdominal pressure. Can also be caused, or the risk for developing a hernia can also be increased due to prolonged standing. So when someone stands for so long, the pull of gravity on the intestines can be so great that they can cause the intestines to push through the abdominal wall. So, in an individual who have already weak abdominal wall, they might develop into a hernia. And prolonged exposure to vibrations. So vibrations as well can cause can increase the force of the intestines of the abdominal and can lead to herniation.
What are the early warning signs of hernia?
The most notable early sign of hernia would be a mass. So when the organ is protruding through the abdominal wall, there is an obvious mass that develops. So someone might notice that there is a mass or a lump on the abdomen. Uh, Another early warning sign can be uh, constipation. So when someone has a hernia, when the organ is protruding through the wall, you can break the flow of feces through the system, and this can cause constipation. So this is when someone struggles to go to the toilet. Another obvious and early sign is pain. For the most part, hernias are painful, and that will be the most common presenting complaint of hernias. So when someone experiences a hernia, most of the times they feel pain. So and most of the times it's unbearable, and they might end up coming to the clinic with that complaint.
How are hernias diagnosed and what tests are used?
A diagnosis of a hernia is clinical because most of the times it's right there. You can see the hump, you can see the lump or the mass on the abdomen when the intestines herniate. But for some, most of the most not most of the times, sometimes the mass can be due to other things. So it might necessitate imaging studies. So this can be this is mostly an X-ray uh, or a CT scan. So you can do a CT scan to see the intestine to verify if it really is it really is an intestine that's herniated.
What are the difference between reducible and the irreducible hernias?
So the main difference between eligible and an irreducible hernia is the ability to push it back. So an irreducible hernia cannot be pushed back into the abdominal cavity, whilst on the other hand, irreducible hernia can be pushed back. So this is done by applying gentle physical force to the lump and try to push back the intestines.
What are the common misdiagnoses or complications of hernias?
So the most common misdiagnosis would be malignancies. So when there is a lump on the abdomen due to a malignant growth, like cancerous growth can be benign or cancerous, or when there is a lump associated with trauma. So there might be someone presenting with a lump on the abdomen due to maybe injury and can be misdiagnosed as a hernia. And complication of the hernia is mostly strangulation. So when the hernia, the blood flow to the herniated organ is cut, and there is an ischemic reaction.
What are the most effective treatments for hernias?
So the most effective treatment for hernia is surgery. So this is done by pushing back the organ and reinforcing the abdominal wall to avoid further herniations. But not every patient presenting with hernia will be suitable for surgery. For the most part, especially when the hernia is not complicated, when the hernia is irreducible and not as painful, the surgery can be postponed. So you wait until when the hernia is irreducible or when there's just so much pain. So this is done to prevent or to avoid the risks that are associated with surgery.
How does lifestyle modification impact hernia management?
So lifestyles that are directly associated with obesity and ascites can can worsen hernias or occurrence of hernias. That's when someone develops ascites and obesity, as I've explained earlier on. That ascites and obesity does increase abdominal pressure and associated with hernias in some individuals. Another lifestyle modification would be a good weightlifting technique. Yeah, so uh, when so for hernias associated with weightlifting, they can be avoided by doing a better or a good technique. So this can be training the cores as well, or not uh, attempting to lift so heavy weight. Another modification would be core strength training. So these are training that can be done to increase the strength of the abdominal wall. Other modifications would be workspace modifications. So these are modifications that can avoid or that can be done to avoid standing for a long time or to avoid vibrations or vibration exposure.
What role does pain management play in hernia treatment?
So pain management would help to increase the quality of life by relieving the pain of the patient. Can also promote activity and autonomy. So, with reduced pain, an individual can be able to carry out daily activities and can be able to achieve autonomy, like to look after him or herself. Can also uh, make care easy, like handling of the patient can be made easy by managing the pain first.
Uh, what are the benefits and risk of surgical repair?
So I'll start with the benefit of surgical repair of the abdominal wall to avoid herniation. So for the most part, the surgery is not so complex. So it can be done in an emergency setting and does not require a lot of resources. Uh, and they can also be used to collect if defects of the abdominal wall. So when the abdominal wall is so weak and so prone to herniation, such surgical repair can be used to repair the wall and reinforce it to avoid further herniation. Uh, Surgical interventions can also be done to repair damaged intestines. So when part of the intestine has been damaged due to herniation, a surgery can be done to repair the damaged intestine as well. On the other side, the risk of associated with surgical repair, a surgery can create other weak points and make the patient prone to other herniations through those surgical incisions or surgical areas where they operated on. They can impact immunity and they can be prone to infections. So a side of the surgery can always get affected, and this can complicate the healing of the surgical wound.
When is surgical repair indicated for hernias?
So a surgical repair is mostly reserved to patients who have irreducible hernias. So this is when the hernia cannot be physically pushed back into the intestine, or when the hernias have been ever so frequent that uh, the risks associated with surgical repair are justified.
What are the different surgical approaches?
So we have different surgical approaches to repairing the abdominal wall uh, for hernia treatment. So there are a lot of techniques like Sodi's technique, there's passing technique, the Steinstein technique, and mesh sublay technique. So these are specific techniques that are done on the abdomen surgically to reinforce it and to reduce the incident or to reduce the frequency of herniations.
How long was the recovery process after hernia surgery?
So the recovery process is variable, dependent on the patient. So this can be due to patient's own healthy status. For example, people with diabetes, they might have a longer recovery period than people without or people who don't have diabetes. It can also depend on the type of surgery done. So if the surgery was more invasive or the incision was large, the recovery period can vary from 4 to 6 weeks. If the incision was minimal and the surgery wasn't as invasive, the recovery period can vary from 1 to 2 weeks.
How do you counsel patients on surgical options?
So help them understand the risks and benefits associated with each and every surgery that's viable, so that they should reach a decision together. Uh, 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 Make them aware of the recovery period so that they should plan their activities accordingly. Also, tell them what the complications of the surgery or the complications of the hernia if the surgery is not done.
What are the potential complications of untreated hernias?
So the potential complications of untreated hernias is mostly strangulation. So strangulation happens when the hernia or the herniated organ has its blood perfusion cut. So due to reduced blood flow to the organ might die, and this can cause a lot of issues with the digestive system and the body in general.
How do you manage hernia emergencies?
So to manage a hernia emergency, there need to be an emergency surgery done. So the the surgery will be done to avoid further damage to the intestines and to repair the abdominal to avoid further occurrence of herniations.
What are the signs and symptoms of hernia complication?
So the most notable sign of hernia complication would be ischemia. So when there is a complicated hernia and it's associated with ischemia, you can see the herniated organ die out, and also you can also observe for gastrointestinal system signs like nausea, vomiting, and constipation.
How do you communicate with patients and families about hernias?
So for the patient and the families who might have an individual with hernias, uh, I help them understand the condition and how the condition came about and how the condition can be managed. So go through the management plans and reach a suitable management plan for the particular individual.
What advice would you give to healthcare providers treating hernia patients?
So I would advise them to encourage their patients for constant check-ins. If the hernia isn't complicated and does not qualify for a surgery, so the patient should be checking in to make sure that as soon as possible, when the hernia is suitable for a surgery, the patient should be operated on. I also encourage them to not hesitate to do surgery on complicated hernias to avoid further complications.
Thanks for your time.
Thank you.